The 16th Annual Hybrid Sickle Cell Disease Educational Summit, Unpacking Sickle Cell, One Warrior at a Time. It is with great pleasure that we introduce our keynote speaker, Captain David Wong. Captain Wong serves as the Senior Advisor for Sickle Cell Disease at the U.S. Department of Health and Human Services, and previously chaired the Health and Human Services Sickle Cell Disease Work Group. With extensive experience at the Centers for Disease Control and Indian Health Service during the COVID-19 pandemic, his focus is on public health and policy. Captain Wong holds degrees from Duke University and completed his pediatrics residency at the Children's Hospital of Philadelphia. Today, Captain Wong, MD, will deliver the 2024 Summit Keynote Address. He will discuss the current state of the sickle cell community and the promising future as we continue to overcome the challenges faced by this generation. Now, let's prepare to be inspired by his powerful words. Welcome again, and thank you for being part of this important event.
Great. Hopefully everyone can hear me. It's a great privilege and honor to be here today. I wish I could be with most of you in California, but I'm not. But what I wanted to do today, I don't know if the slides will come up or if you want me to drive my own slides. But what I wanted to just share at a high level is what we're doing at the federal government to help improve the lives of people living with sickle cell disease. And of course, people know there are many different federal agencies, and we are within the Office of the Secretary. And so we have more of a coordinating role, working with CDC, NIH, CMS, et cetera. They're very important partners of ours, but we also have our own portfolio and projects that we lead as well. I want to share some of that with you today. Excellent. And so while we're pulling those up, I'll just say it's, I can't see anyone in the room, but hopefully there's some familiar faces in there because I worked on sickle cell from 2018 to 2020 in a very similar role under Admiral Giroir, and really appreciate that time there and learning from him, learning from the warrior community, and very grateful to come back in an official capacity in March this year. And with this first slide, if we're able to advance to it, what I wanted to share was just how our work has changed at a kind of a mission approach level. And a couple things that we're really doing differently this time around that we didn't do, in my opinion, as well in 2018 to 2020 was two of our priorities. And it'll come up here in just a second, but I'll just go ahead for the sake of time. First of all, the vision for our work is empowered and thriving sickle cell disease warriors and communities. That also happens to be the theme for the inaugural HHS Sickle Cell Disease Summit, which will happen next Tuesday in Washington, D.C. I hope some of you are able to attend that in person, or if not, you can attend virtually as well. But we specifically have two words in there, empowered and thriving, that are driving some of our new work and our new priorities. And so with thriving, that's a very clear nod to quality of life. And we hear so many times from the warrior community how important quality of life is. The warriors are much more than just their sickle cell disease. There's so many more elements to them that can help them live their best life. And so we're trying very intentionally, you'll hear a little bit more how we're doing that specifically to raise that quality of life for warriors. And then with the word empowered, we see that as in order to really empower or help empower a community like warriors, we at the federal government have to take the time to really listen and understand what are those needs, what are those gaps that we can fill. And so that really leads into our priority number one, which is to engage more meaningfully and as sincerely as we can with the sickle cell community. So how are we doing that? Next slide, please. I'm not going to go into all of these details on the slides. I'm just going to give you a snapshot. I think one of the things that we're trying to do this year is to have regular public events and with high-level HHS principals who are engaging, showing that the highest levels of this government and this administration care about the sickle cell community and are really trying to lift up the voices and raise awareness for these very critical issues. And this is all crescendoing into the summit that I talked about that will happen next week. And you can register here on the link. There's a QR code later. I will say that we actually had to close in-person registration today because we have over 500 people registered. We had such a great response to this event, and we hope it's going to be very high energy, impactful, very much like this event that you're holding here in Los Angeles. We've also added this sickle cell resource box, SCD at hhs.gov. Some of you have already started to communicate with us that way, but this is, just to make it easier to engage with the community. Sometimes you don't really know where to send an email. Well, this is your one-stop shop. If you have a question about sickle cell, send it to us. We've got a team of people that are manning that box, responding to the community, and trying to, get back to you as soon as we can with answers. And then the other thing I'll mention on this slide is at the very top, we launched a new series called SCD SOAR, and SOAR stands for Services, Opportunities, Activities, and Resources. And this is what I like to think of as sickle cell disease resources with a little s. These are not the big sickle cell programs like Cure Sickle Cell Initiative, the HRSA Sickle Cell Disease Treatment Demonstration Program. Those programs, many people in the warrior community know about those programs, have heard about those programs. That's not to say there's not additional engagement and awareness that needs to take place with those programs. But what we want to do with the SOAR series is highlight other federal agencies and other programs that are also very relevant to warriors and their families, but maybe you don't know much about the resources that could really help you in your life. And so the first session that we had was in August on mental health, when we highlighted SAMHSA. And our next session will be in October. Date is still to be determined, but it'll be with HUD focusing on affordable housing. And every 2 months, we're going to introduce the warrior community to new agencies and new resources. Next slide. With this slide, I just want to highlight the last one, which is an effort that we're just starting on, but we think it is so critical. And that's to really try to strengthen the partnerships between the sickle cell community and with state Medicaid agencies. It's so important, as we all know, with approximately 50 to 60% of warriors are enrolled in Medicaid. But we think that that partnership can be strengthened. And if you strengthen that partnership, that can hopefully lead to better access to services, access to information, access to quality improvement programs, wraparound services like mental health. State Medicaid does all of that. And so what we've tried to do, just in these early stages of this effort, is to learn from other state Medicaid agencies about how stakeholders can better interact with them. And I'll just say that one thing that was very helpful for me in this space is when I left sickle cell in 2020, one of the things that I did was I worked on community health workers and financial sustainability for them. And one of the things that they're looking to do at CHWs is to try to get more Medicaid reimbursement and recognition for their services. By working with CHWs, I met with many state Medicaid directors and their staff. And I was able to use those connections to basically find out and get information and suggestions about how the sickle cell community could better engage with state Medicaid. And so there's some examples down here, but one of them I just want to highlight is the medical care advisory committees. Every single state Medicaid agency is required by regulation to have a medical care advisory committee. And these committees are public meetings, and they must have consumers on the committee. So what's to stop people, warriors, to running for, being on these committees at different states around the country. At a minimum, the warrior community could attend some of these public MCAT committee meetings and start to learn and meet the state Medicaid leadership, get a better understanding about the priorities for that state, and have a better chance to advocate them for the needs of the sickle cell community. So more to come with this, but I think this is so critical. Next slide, please. I'll skip this slide for time. I see I'm already over my time. I apologize for that, but I'll just say a couple of things very quickly with the next slide. With quality of life, which, as I mentioned before, is so important. We did not do much at all with quality of life when I was leading this back in 2018 to 2020. But with next slide, what we're doing with quality of life, I mentioned mental health and SAMHSA. We have had one panel, which was an all-warrior panel in July. We called it the Thriving Warrior Panel. It was the most attended panel that we've had all year by far. Almost 500 people attended that. We know that mental health is so important across the lifespan for warriors. And we also hear from many warriors that their access to quality resources, their comfort with discussing the sensitive topic with their hematologist or other providers, or finding the proper support systems within their own families and friends and networks is lacking in many cases. And so we really want to lift up mental health for all types of warriors. And there's going to be several events that we plan related to that, separate from the SCD source sessions coming up. And then I don't see the next slide yet, but if people can advance, I also want to highlight one more thing, which is our partnership with Social Security Administration. We know this has been another important issue where children, especially with sickle cell disease, are being denied their disability claims. And we've been partnering with Social Security Administration since earlier this year. And I can tell you that there's some exciting products and guides that they're developing to help both the warrior community to be prepared for these disability evaluations, to understand what kind of information they should bring to these evaluations so that they're more likely to succeed in qualifying for disability. And there are also tools that are being developed for providers who take care of individuals with sickle cell disease, all with the idea of trying to improve the process for disability claims for the sickle cell community. So they're doing some really amazing things, and some of those products should be coming out shortly. And then I guess there might be an issue with the advancements on the slides, but really the last thing I wanted to show was a image of our promotion for the warrior community at the very end, the last slide. Sorry, there was a list of our partners and colleagues that I work with, and a really wonderful photo earlier with Admiral Levine, my big boss, and Linda Thomas Wade. I don't know if she's in the audience today, but this was the kickoff for my second tenure in sickle cell disease. And I just think these pictures are just so powerful, and just seeing symbolically the connection, the collaboration between the federal offices with Admiral Levine and the warrior community represented here by Linda Thomas Wade. This is the kind of energy and relationship we want to see moving forward all over the country. And then just going to the last slide, I'll just say again, like, we really hope people will tune in, even though we closed in-person registration for the summit next week. We have unlimited viewership on our virtual live stream. If we can go to that last slide, please. Yeah, next one, please. And I'll just say here, this image of the that we're using as the graphic, this was inspired by the signs and placards that were used during the 1963 March on Washington. And so we wanted to evoke that same kind of feeling, that sense of community and advocacy, because really the sickle cell disease fight today is an extension from that civil rights era. We still have to continue that fight. And that's why we chose this imagery that pays tribute to that era. And so with that, I will just turn it back over to Dominique. And again, I apologize I couldn't be there with you today, and I hope to see many of you in person next week.
Thank you so much, Captain Wong. That was an amazing presentation. Thank you for taking the time to present to us. Give Captain Wong a round of applause, everyone. Woo! Thank you.